Welcome. Step into the lab. On this podcast, we will be discussing the practices, research, science, and technology surrounding alternative medicine, where listeners will gain valuable insight and information with every episode. Just as a reminder, the Mind or a Lab podcast is for educational and informational purposes solely. All subjects on this podcast should not be construed as medical or legal advice. You should always seek out help from a professional provider. Thank you. Hello, welcome back to the Mind or a Lab podcast with your host Dorian G. I'm sitting today with Dr. Robert Quinn out of Henderson, Nevada. How are we doing today, Doctor?
Hey, I'm doing great. How about you?
Doing well. Thank you for being here, taking the time to sit down and speak with me about these hot topics around Prism Earth, the company that you are currently a co-founder with. So just before we get into that, can you break down where you're from, where'd you grow up to the audience?
Sure. And thank you for inviting me, Dorian. I'm looking forward to this sharing of ideas. I'm originally from Southern California, one of those beach guys, Manhattan Beach, El Segundo area. Went to school there. I did my undergraduate studies at Long Beach State. I was a chemistry major, right? Totally interested in the sciences. That was kind of my little niche. Then decided I would go to graduate school. So I went to University of Southern California to pharmacy, got my doctorate degree in clinical pharmacy there, and then began my practice. In pharmacy, much as medicine, there are a lot of different areas that people can go into. It's not well known. People mostly think that pharmacists are the guys they see at CVS or something like that, and that's what we call community or retail pharmacy. That's fill them as fast as you can, and don't make any mistakes because you can't hurt people. Okay, but there's a lot of other things. There's research and there's hospital. And there's a lot of different areas. So I did most of them. I think I did them all. There's even sales. There's so many things that you can do within this field that people don't know about. The most recent thing I did in 2010, I opened up a regenerative medicine center, pharmacy compounding unit, and a regenerative medicine center all in one. Now, what compounding pharmacy is, for your audience, is the making of medicine through raw ingredients. We don't just take the products that big pharma makes, and as the old cliche is, put them from a big bottle into a little bottle, right? It's not that. We do this all from raw chemicals, and it is. I like to tell people it's real medicine. We made over 100 different strengths of thyroid. Okay. And when you're messing with the thyroid, you better know what you're doing, right? Because that's so critical. Okay. We also made ophthalmic products for glaucoma and things like that. And again, when you're doing something for the eye, you better be real accurate. You better know what you're doing. We also did intravenous admixtures for detoxification and immune boosting and things like that. So it's really a great type of area to practice in because you get to create things and you get to help people on an individual basis. They talk about personalized medicine. That's truly what it is. We did a lot of hormone therapy and whatnot, and it really is personalized. It's not just the one size fits all kind of thing. Okay, and so there is a huge movement now on both sides of this coin. The compounders out there are doing some phenomenal things. And I closed my pharmacy in 2020 after the pandemic to get into the cannabinoid manufacture. But right now there's a big movement for compounders to continue to do these things because personalized or precision medicine is the way to go. And on the flip side of the coin, we have issues with big pharma. Okay. And you may
Okay.
throughout hear me call them out because, as they have stated, we're not in business to help people, we're in business to make money. Okay. That's direct quotes. Um, they don't like compounders, they can't stand it at all. They believe all the money and all of that stuff should go to them, that they deserve it. Whether or not they do toxic products or not, that's not their concern. Okay.
Yeah.
So that was one of the main things that got me into the past 12 years or 12 years of doing compounding, was that we could actually help people on an individual basis. And I didn't have to answer for a drug company. If someone came in and said, hey, you gave me this prescription for my heart meds, and now my knees hurt,
Hmm.
what's up with that? Why'd you do that? Well, I didn't do that. So
Right.
again, I digress, but compounding was, to me, the way to really get back to my chemistry roots and make things right. And
So,
then go ahead.
so with compounding, can you kind of like walk me through that process of being personalized for an
Sure.
individual? So, like an example of, let's say, the knee pain that you just referred to, what would be the process to develop a treatment through chemistry to make it individualized for that person?
Okay. Well, I'll tell you what, Dorian, the best example I can give you is bioidentical hormone therapy.
Okay.
Okay. And that is something that has got to be personalized.
Mm-hmm.
Everybody has different needs, and as far as hormones go, and
Mm-hmm.
these are, we say, bioidentical because the chemical molecules are, testosterone is testosterone, estrogen
Mm-hmm.
is estrogen. For decades, patients were taking, and mostly women were taking, hormones for menopause and things like that. And they were, the number one drug sales in the world was a drug called Premarin, which was an
Mm.
estrogen, and they called it conjugated estrogens.
Okay.
And that led to a great uptick in cancers, we'll say. The word Premarin stands for pregnant mare estrogen. These things came from horses, right?
Okay.
And we, you don't want hormones from other animals. You want
No.
human hormones. So then bioidentical hormone estrogen was created, and there's more than one estrogen. There's, estrone, estradiol, estriol. And so we would compound using those based on a person's A, symptoms, and B, very detailed hormone testing, where we've got about 28 metabolites of hormones that our bodies go through every 24 hours. They're all broken down into different things. Right. So we would look at lab results to see where people's need were. And then we
Mm-hmm.
would come up with a product that would maybe have some estrogen, progesterone, testosterone, or DHEA, things like that in there. And the results were phenomenal. People would say, "Oh, you gave me my life back. I've never felt so good," and all that kind of stuff. So that's kind of the specificity that we use.
Okay. Interesting. So you're basically seeing the lack of based on test results so that you can pinpoint the necessity of what needs to be introduced back into the body, essentially.
100%. It's hormone optimization is what it is, and it even goes deeper than that, because sometimes our bodies don't break these down the way we would like them to.
Mm-hmm.
Um, Sometimes they're broken down into hormone metabolites that can lead to future cancers, right?
Mm-hmm.
So we don't want that. So then we analyze for various, actually, supplements
Mm-hmm.
that can change the metabolic pathway, and, as push it over to the good side, as opposed to going down the path to the bad side. So it is a phenomenal area, and it is extremely necessary for people to have this test, because our hormones change with age, as everyone knows, but it's a slow change. Men, sometimes they call it andropause now. Women have menopause, but men, generally, we don't notice. It just slowly sneaks up on you, and suddenly you go, wow, look, I got a quote unquote beer belly. or
Hmm.
something like that. Well, hey, that's a lot of times that's your hormones talking to you.
Which is the importance of living a healthy lifestyle.
Oh
And
boy,
so,
yes.
so, how did you go from compounding pharmacy to get into the cannabis like field? Did you have a defining moment when you were younger that kind of led you as down this path as an option in the future, or was it something like further along in your career that made you come to this realization that you were in the wrong field?
Good question. I had a couple of defining moments. One of them that I didn't even know it was when I was at USC. I lived next door to the Doheny Eye Foundation. All
Okay.
right. And had heard that people were using cannabis for glaucoma.
Hmm.
And I thought, well, that's pretty interesting. Wow. Okay. So, now everybody in college, if you're using cannabis, I guess you won't get glaucoma. That's pretty cool.
Hmm.
Right. So that was the first kind of thing that I was introduced into. Maybe there is a medicinal kind of thing. Now, everybody knew that with certain, they called them strains at the time, and now they're cultivars. But everybody knew, well, hey, I can get the munchies here. Okay,
Hmm.
well, that for those type of people is not therapeutic, but for a person suffering from a cancer treatment, chemotherapy, or something like that, who can't eat, right? That is therapeutic. Right?
Hmm.
And then, I mean, there are other little things like that happen where people would say, "Oh, I have panic disorder, and the only thing that helps me is to quote unquote get high." Right.
Hmm.
So we said, well, wait a minute. Okay, now if we believe this is safe, then there are some therapeutic things that can be done. So then, as time went on, um, I began to realize that people were saying medical cannabis. They were
Hmm.
using terms like medical cannabis, and at the time, people had to have a medical card to get some, and they were going to dispensaries and getting things, and that was hit or miss. No one knew what was happening there, but
Right.
in a lot of cases, people were benefiting. So I said, well, wait a minute. If we're really going to look at this as medicine, let's make medicine. So I
Hmm.
took all of the experience and the equipment and everything I had for the compounding and went by standards. It's called USP, or United States Pharmacopoeia Standards on Manufacture.
Heard
And
of it.
you can't say manufacture, you have to say compounding, right?
Hmm.
Took all of that knowledge, those standards, and my knowledge of patient outcomes and medications and
Hmm.
science, put it all together to develop products that I felt we could target certain therapies with. And that's kind of how it was born. And we did a lot of research, a
Hmm.
lot on what to put in there. And that's why, as you know, Dorian, from reading our site, we have products that have amino acids and homeopathics and herbs and all of that kind of stuff because we're targeting certain wants that people have or needs that they're going after looking for treatment.
Before we get into all that, on a personal level, how has cannabis benefited you, or have you experimented with any other psychedelics?
You know, recently I did microdosing of psilocybin,
Hmm.
and it's interesting why I did that. Researching that, I have found that psilocybin itself is phenomenal when it's done correctly. Unbelievable! It's more powerful than you would believe. Okay,
Hmm.
so I wanted to do microdosing to see if anything would happen because my company, that what we make now we call cannaceuticals. You might have seen that on our website,
Yeah,
right?
I
Which
saw
is
that term.
pharmaceutical based cannabinoids. Okay, so now my company is talking about what about cannadelics? What about
Mm.
cannabinoids with psychedelics? So I've just started to research a little bit of that. In my past, well, let's say in the future or after school and during practice, um, I would take a lot of supplements and I
Hmm.
take amino acids and I take homeopathy and I do all of that kind of stuff. and then knowing that the cannabinoids will balance the various systems in the body, whether it's endocrine or your GI or anything like that. My thought was to combine these. And the
Mm.
one thing that I take now, there's a couple of things. I take what is known as essential daily balance that we
Mhm.
have because it's got anti-inflammatory in there. We are all inflamed from the environment or what we eat, right? So I've got anti-inflammatories in there, um, stuff for circulation, because
Mm.
you got to have circulation, or who cares if you're taking nutrients, right? If they're not getting to the body, they're not getting there. So
Right.
that's the thing now that I take routinely is our essential daily balance, and it's more a case of I know it is benefiting me, and I'm not going to stop because I don't want to have any kind of a fallback or a downhill course in the future. I'm going to make sure that all my processes are doing well, and that's a major part of it.
Yeah, absolutely. And I think now that your your view has changed overall, obviously, since you started this company about the benefits of cannabis for your own personal lifestyle. It also, helps people understand that you can be a professional in any field with intense, detail oriented tasks and still be a functional person by using these phytocannabinoids, like as a supplement.
Oh, completely, completely. And I think the area that you're kind of touching on is I've been seeing this and hearing this a lot on other podcasts is
Mm.
people who say that they are recreational users
Yep.
and high dose, low dose, frequently or infrequently, but their thought processes and and let's even say creativity, cognition is not
Mhm.
impaired.
Yep.
Now, that's not to say maybe when somebody has partaken and they might be high, that you're not going to have them do something that they may not be capable of doing to the best of their ability when they're not. But there's no carryover that anybody is seeing. When you're on the job, you're on the job.
Mm. Mhm. And yeah, and it takes the edge off for me, especially like before I hop in to these interviews, because I like to basically unwind and just not overthink the process of getting something started project wise,
Yeah,
and just like diving right into it because it's already up there. It's just doing the action. And I think it's a great tool to get over that hump and get to that mechanism of action.
right. I agree 100%. I think that what we're talking about here is if you allow it, it will allow you to focus. It
Mm.
will allow you to pay attention. And to my way of thinking, what we're doing is we're knocking out the so called monkey mind to
Mhm.
where you and I are talking about this subject in this podcast. And I'm not thinking about, do I need to take my car in for repair today? You
Yeah.
know,
Yeah.
I'm able to concentrate and I'm able to focus on
Yep.
what we are talking
So when you started Prism Earth, what was the mindset? What was the goal that you wanted to foresee in the future?
the goal really was to make sure that we had good, solid products that would help people. And we started with just a couple of them. We started with pain and sleep.
Okay.
Okay. And the goal was to get real products into the hands of people in need to get to knock down two things.
Hmm.
Number one, to knock down the stigma, which others are doing, right?
Yes.
And the other one is to knock out useless products, to knock
Mm.
out things where people have bought something because a dispensary agent, bud tender, whatever you're going to call them, or a fancy package lured them to buy it, right?
Hmm.
We, again, wanted to make real medicine. So I knew I was doing that. And I experimented with my products for, oh gosh, a couple of years. And then I was fortunate enough to be introduced to a couple of orthopedic surgeons. One who is a spine surgeon out of Arizona, Sonoran Spine. I don't know if I should name him, They've got about 8 different centers, spine centers in Arizona. He's
Hmm.
in Phoenix, and these guys understand the need for this and the benefit for this. My other orthopedic surgeon partner is a clinical professor at USC and is
Okay.
also a pediatric um, oncologist at Cedar Sinai. Okay, so
Awesome.
these are some real heavy guys that are, will challenge you as far as not only the science goes, but will challenge you as far as the therapeutic goes. And that, I believe, is one thing that really is our advantage, Dorian, is that we're not only the scientists, the chemists, right? The cultivators, the extract, we're not only those guys. We're the guys that understand the science, but then also can apply it to the therapy. So we've got both ends of this. And that was kind of the kickoff for us. As you say, what led to it? Well, it was knowing I could make great products, but then also having the backing of people that understood it as well and were treating tons of patients in need.
Yeah, so let's focus on the patients. So, out of this necessity to create a product that had a level of efficacy for people developing a certain symptom cycle, which was the demographic that most stood out that you provided this product for?
Um, Actually, it would be, well, first of all, my philosophy is, and especially if you're talking about smoking,
Hmm.
it's just my personal opinion and Harvard Medical that no one under 25 should do that. Okay, the brain is still
Hmm.
developing. All right, so I don't
Hmm.
recommend that. I don't
Hmm.
recommend smoking as far as that goes unless people have a major need, right? Anxiety, PTSD, something like that.
Hmm.
Panic disorder. There are reasons to use that acutely, and basically, we're talking about the onset of action is
Hmm.
quicker. With oral products, it's 45 minutes.
Yeah.
Okay. So knowing that, I targeted mostly older people,
Okay.
and we would say people that have chronic conditions. Okay, if you break your arm or break your finger or something, right?
Hmm.
You better go get acute treatment. They're going to give you some opioids. They're going to take care of that. But now, as time goes on,
Hmm.
you want off those opioids, and that's where we come in
Okay.
to have more of a chronic relief of symptoms, whether it be anxiety, we have a product for that, or it be pain or sleep or something like that. So we're targeting people that mostly have a chronic need. Generally, for the most part, 35-year-olds don't have, I would say, as a class, are not as great of a target audience as older people are. Because as we age, stuff happens,
Hmm.
and
Yep.
chronicity, it sneaks up on you. It really does. I mean, you could be an athlete, a high school athlete, and you got hurt or something in high school, but then you start to get into your 40s or something, and you go, oh man, that's sort of acting up on me.
Hmm.
So our market, I think, is everyone obviously with a need. I would say anybody that has sleep issues or pain, sure, no matter what age you are, an
Hmm.
adult,
Hmm.
fine. But the greater audience are people that are probably older.
That makes sense. So, with this product development, why did you feel the need to introduce ingredients such as amino acids with the products?
Great question. Great question. It started out when I was looking at something for sleep.
Okay.
And so I tried to design. Now, let's back up. The cannabinoids and the endocannabinoid system is all about balance.
Hmm.
And balance can take some time. Balance isn't always quick, right? As I mentioned, that's, our acute versus our chronic. And I think people understand those terms. Acute is
Hmm.
something happening right now, and chronic is it lingers. Okay.
Hmm.
So when we looked at the cannabinoid balance, is it okay? Well, that might take some time, but what can we do to put in some ingredients that can help in the acute phase. How can we get this action a little quicker while we're balancing our body?
Mhm.
And so it started with the sleep thing. And here comes the science. I put in something called GABA, gamma aminobutyric acid.
Mhm.
GABA is the only neurotransmitter that works in a retrograde fashion. And what that means is we go back to the monkey mind. You're going to bed and you're trying to fall asleep, and all these neurotransmitters are hitting your brain and you're bouncing all around. I mean, you're even thinking about what you did 10 years ago. You're like, what is that? Well,
Yeah.
GABA works retrograde fashion and kind of buffers that and calms that down. Okay.
Mhm.
And that was something that I knew we had to have there. Because if you realize in pharmacy, oh, yeah, we got stuff that'll knock you out.
Mhm.
No doubt.
Mhm.
I can put you to sleep.
Mhm.
Okay. But that's a chemical that's outside, and oh man, we don't want dependence. We don't want hangover. We don't want a lot of those things. All right, with
Mhm.
our niche and where we are. So what I say is our product allows you to sleep. It doesn't put you to sleep. It allows you to sleep. And then of course, then we put in, L-tryptophan, an amino acid that is known to help calm the mind and that kind of thing. We have a little bit of melatonin in there, which besides being an antioxidant, also can like balance you and help you sleep. And then our cannabinoid blend with specific terpenes that are calming.
Mhm.
So coming up with this whole thing is like now I have something that people can take to get some relief as they go. And then maybe, what is it, 3 days, a week, 2 weeks, whatever it takes for your body to balance everything out. We've got the cannabinoids in there. And that's kind of how it started, with the idea of adding other ingredients.
That's amazing. And, just with me personally, like practicing bodybuilding 10 years ago and just going through the amount of information that was available then for specific amino acids and what they contribute to the body, I did partake in using GABA at a time, and it did help me slow down my thought process because my brain just constantly thinks of new ideas all the time, and
That's good.
even playing with like playing video games overstimulates me sometimes too. So it's like, all right, cool, what can I introduce into my supplementation routine that would allow me to decompress when it gets
Yeah.
dark? And like doing research on GABA was one of those first components that I introduced, and then I started getting into the other forms of supplements like magnesium that
Oh, sure.
all that helps tremendously put me to like not just put me to sleep but keep me asleep,
Oh,
where I
yeah.
didn't
Yeah.
feel like I had to wake up in the middle of the night.
Exactly. And we do have magnesium in the sleep too, right? We've got a bunch of different things. The other thing that's really cool about this is when there are other things that come out, non-prescription, okay? I
Mhm.
can't touch prescription meds. When there are other things that come out, we can add them. We can
Mm.
modify our product, which I love. I mean, that's the creativity. That's the whole world that's out there. And as new discoveries come through, hey, let's see if we can do this and help people.
Yeah, for sure. The one question that I did have about your ingredients into the product was terpene introduction.
Mm-hmm.
So, can you explain how the terpene introduction going through your digestive tract adds to the benefit of the product overall, because we know through inhalation that those molecules specifically are targeting the circulatory system and olfactory system before you even smoke it
Mm-hmm.
and give you some sort of benefit. But I have not heard about the research that is through the digestive tract.
Yeah, it's kind of new stuff. There is a PhD researcher out of, I believe it's Finland. His
Hmm.
name is Arno Hazekamp. He has done
Okay.
a lot of work. I don't know if you're familiar, a lot of work on terpenes, and they're finding that, yeah, that they are working. Um, it's going to be a case of individuality. Everybody's a little bit different, kind
Hmm.
of thing, but uh, the terpenes are adding to the activity. Now, we can also say that the way Mother Nature made the plant, there's
Mm.
terpenes in there. Okay. So we are making sure that there's total benefit there. Now, if someone were to ingest an oral cannabinoid product and it did not work, then we would know, well, okay, we got to go with inhalation. But
Mm.
the fact that these things do work orally gives us hope that we can modify these terpenes. And I'll tell you what, they are very powerful, very powerful. And you're
Mhm.
right, the olfactory thing. I mean, because what do they say? That's like the closest scent to your brain. So
Mhm.
the sense of smell is really powerful, right? So we also know that systemically we are getting some activity here. We've done things where we left them out,
Okay.
and I don't. It's the entourage effect, if you're familiar with that term.
Mhm.
Right. That's what it is. And so I'm a true believer in the whole plant. I mean, I'm just kind of like one of these guys that I'm. Yeah, this is heresy, but I'm against like fresh squeezed orange juice.
Mhm.
Okay, because we're getting the sucrose and the fructose and things like that, but we don't get the pulp.
Mhm.
We'll get a little vitamin C, but we don't get all the other things. You got to eat the fiber. I think it's better to eat an orange than it is to get the squeezed juice or to go buy ascorbic acid capsules. Eat the darn orange, right? That's the way nature made it. And I've taken that philosophy into this plant thing. Also, we have started doing what is known as spiking, which I don't know if you know who Ethan Russo is. Um,
Yes.
okay. For years, he was against spiking. He kept saying it's a natural product. The natural thing is best. Get something that's grown, to show the cannabinoids that you want
Mhm.
and use that. And I think recently he's kind of changed his tune a little bit. So we have been doing spiking the whole time by adding terpenes. So now I'm going to make sure that I've got some systemic activity as well.
So, explain spiking real quick.
Okay, well, let's say you have a cannabinoid cultivar and it will have certain terpenes in there, right?
Mhm.
And maybe I'm using that one, but I would like to have a little bit more linalool from
Mhm.
lavender to calm you down. So
Yes.
we're putting some of that in there as well.
Okay. So you're basically doing the same thing as you were with compounding. You're trying to individualize what a product could do
Right.
potentially for someone that wants to experience those certain
Mhm.
side effects.
Yeah, yeah, exactly. Good way to put it. Yeah, yeah.
Okay. Cool, cool. What kind of extract are you using and how is it getting extracted?
Um, right now, and we look for different ones, but right now it's,
Mhm.
it's mostly CO2.
Okay.
As we had mentioned before this, I used to own an extractor, an
Mhm.
Apex machine, so we experimented with all that kind of stuff. I'm comfortable with that now, but I do understand that there's ice and there's tons of different things to do. I won't do butane, but
Mm.
there are tons of things, and like everything in science, hey, keep your eyes open because new stuff comes along that may suit your needs, maybe a little bit better. That's the way health is anyway. So
Right.
I'm always open to that. But as of right now, I'm just using CO2 extracted uh, materials.
Okay. Yeah, no, and I used to run CO2 extraction machines, so I know the benefits of the full spectrum extract, and I
Yeah,
saw the varieties of minor cannabinoids that
yeah,
accompanied THC and CBD. So
yeah.
that's great that you guys are using that
And
type of a
there's a
product.
definite art to that. So I'm impressed with these extractors, right? Because I do understand that people think you throw in some flour into an extractor and you got this nice oil that comes out,
Mhm.
whereas it's a bunch of goop that comes
Yeah.
out and it has to be
Yeah.
processed,
Yep.
right? So it's not that easy.
No, you have to refine it down to the desired outcome, and
Yeah.
it really isn't. But I love that art form. It's amazing to me.
Oh
Uh,
yeah.
No, but no, that gives me a clear picture of the product. So, you know, when when you started this, who were your primary customers? Like, who was reaching out to you when you started releasing these products?
What a great question. There were a few people that I had from my compounding pharmacy
Hmm.
who knew patients, who knew what was going on. I had to be very careful, right, on who I talked to because the
Right.
government hates compounders to begin with, and then if you do anything out of the ordinary, they want to kill you. So it
Yikes.
was a very limited thing, and then I used my connections with our orthopedic surgeons
Hmm.
who had patients who wanted something. And in the beginning, we only marketed to and sold to physicians' offices or other
Mm.
clinicians, right?
Okay.
Physical therapists or whatever.
Yeah.
And then we decided, you know what, this is too great. It's too big. We're going to allow public sales. So it went from a very narrow market
Hmm.
of like first person word of mouth kind of thing
Right.
to now anybody and everybody who has a need.
Oh, that's awesome. And with your amount of people that are taking these products, like what can newcomers expect to gain from taking your products?
What? I'm sorry. Repeat that.
What can newcomers expect to gain from taking your products?
Oh, great question. Uh, First of all, therapeutic relief is what I'll say. We're not going to cure anybody of anything. At least I don't think we are. But we're looking for therapeutic relief. We are alternative to things that are put out by big pharma. And the more I got into this, as I mentioned before, um, I struggle with what big pharma does. Now, having practiced in hospitals, I understand. If you got a blood clot, you're going to need a drug that's going to dissolve that clot. Okay,
Mhm,
there's a place for these things. But
mhm,
let's make sure that we distinguish between, and it's very, very, very critical to understand what acute versus chronic is. Take, for instance, you have like Prozac and things like that. Okay,
mhm.
that drug is designed to be taken for a limited period, 1 month or 2 months. I had people who were taking these things for 1 to 2 decades. Right?
Wow.
That is not what we should do. So, what people can gain from this, as you ask, is a mechanism, a method to gain relief without looking for harmful side effects. Right? Those are pretty much off the table. um, and something that they don't have to worry about dependence or hangover effects or anything like that. And they're reasonably priced. So, what our motto is we strive for efficacy, safety, and cost. Everything we do, efficacy, safety, and cost. All right. So we only put safe ingredients in there. Efficacy is what kind of amounts, what ingredient, what are we doing to make sure they work for our intended purposes, and cost, knowing that you're not going to be able to have insurance pay for this. We try to do this at a reasonable cost so people can expect products that will affect what they're looking for. They are effective. They're designed to be taken for a longer period of time than a week if you need
Mhm,
to,
mhm.
with safety in it and at a reasonable price.
The one thing that I wanted to ask, compared to other products, how does yours differ in bioavailability for people getting that onset of action?
Um, the pharmaceuticals in there will have a much quicker onset than the cannabinoids will. So,
Mm,
in other words, in our pain product, we have MSM. Don't know if you're familiar, methyl sulfonylmethane. It's kind
okay.
of like you see it in a lot of products with glucosamine and chondroitin and MSM. All
Mhm,
right. So now that's going to act pretty quickly. And then there's also another one in there that I call our secret ingredient, which is going to knock your socks off. It's called PEA. It's palmitylethanolamide.
okay.
That is for pain and inflammation. Works quickly. So as I said, we've got these things in there that are going to work pretty quickly. So your onset with those is pretty darn fast. And
Hmm.
then, as I say, the cannabinoids kick in, and then we can use this long term. I hope I'm answering your question.
Yeah, no, for sure. That's detailed. And if the audience didn't know about these, why did you introduce these into the products specifically?
Good question. It has to do with the research that I
Okay.
did, knowing that there were things out there. Now, remember, coming from a an allopathic pharmacy background, right?
Hmm.
The mainstream healthcare slash sick care that we have here in America
Hmm.
leads you to focus on opioids, non-steroidal anti-inflammatories. There's like 10 of those.
Hmm.
Um, Gabapentin, things like
Hmm.
that that can be used for seizures as well as nerve pain, and
Yep.
that's where your focus is. And
Yep.
so once you look away from that and you see that there are other things that work, then you're able to kind of go into this with a more open mind and step away from the mainstream thing, and we create products that do help in a fabulous way. You did ask about bioavailability, and I will say
Hmm.
one thing about our topical cream,
Hmm.
which is by far our best selling product. And I could tell you stories about how well these things work. The bioavailability of that is
Hmm.
critical. I always tell people um, it's really not effective to have cannabinoids or other ingredients in a base that doesn't penetrate the skin.
Okay.
People out there will put CBD in coconut oil, emu oil, motor oil, anything they can get their hands on to throw some CBD in and go, hey, I got an oil, try this. Okay.
Yeah.
All right. We use an FDA approved base. It's a liposomal base. Here comes the science again. A liposome is a molecule that's a carrier molecule that goes through both your hydrophilic and hydrophobic layers of your body. So the way I like to explain this is you got a hydrophobic layer of skin. If you if it was only that and we didn't have the lipophilic or the fat
Hmm.
liking layer, you'd drown in the rain. Right?
Yep.
You outside, you would just all get absorbed and you'd drown. Okay, so we got a layer here that keeps us safe from that. Right. But
Right.
you can't just put like lard on your skin and hope that gets into your body. It's not
Oh
going to
boy.
work. Like no one would do that, but you get the idea.
Yeah. Yeah. Yeah.
Okay, so this liposomal base, um, without getting too much into the chemistry, it allows on one end it's hydrophilic, the other end is lipophilic, fat loving, water loving, with the active molecule on the inside, and
Okay.
it pulls that through all 7 layers of the skin. Now you can say there's 3 layers, but the dermis has got 4 layers of its own. But
Right.
all 7 layers into the body. That's the key. It's not the CBD concentration, because you'll see process say 3,500 milligrams of CBD in this box.
Hmm.
Well, if and that's one of the labeling products, is that that's not what's in each one, and it's not how much is there, it's how much gets into the body. Okay,
Mm.
so that is a product. Those type of products are just shock value and they don't work. If they do work, it can be to a minimal degree, and it can be mostly attributed to rubbing. Right,
Mm.
you're
Hmm.
cause when you get bumped, you get a bruise or something, you rub it. Well, why do
Mm.
humans do that? Well, actually, why would that doesn't stop the pain. You know what that does is that brings our endocannabinoids there to stop the pain.
Mm.
It's like I told the surgeons, and this was one of the things that just got them, my partners, and I said, okay, you deal with surgery, you deal with pain all day, why do people moan? Never thought of that. Endocannabinoids. That's your cannabinoid system trying to help you with the pain.
Mm.
So now we are, in our topical product, we are bringing the MSM that we mentioned in there, the PEA, we've got curcumin in there. We're
Hmm.
bringing these things into the site it needs to be for activity.
Okay.
That's why it works so darn well.
Can you explain the chemistry behind that?
Uh, okay, well, the chemistry mostly is the liposomal base.
Hmm.
And it's like the liposomes have got like a head and a tail on them, and it's a lipid bilayer. So it's like
Yep.
this: you got two layers right here, okay, and then what we're doing, if this works, we're putting the active ingredient inside, and the
Hmm.
whole thing is biochemically going through the skin. These will dissolve off, and you're left with the active ingredient in there to work at the site of pain. Does that make sense?
Perfect. Yep, perfect explanation just for people to understand that
Yeah,
what he's mentioning is that your skin is pushing off water, but with this base it helps absorb it through that
yeah,
layer of fat that gets down into your body, and then once it reaches the seventh layer and moves past that, then it can move into your circulatory system, depositing this compound that they have inside of the fat bubble.
exactly.
Yeah.
Exactly. Now some will get into the circulation, not a ton of it,
Mm,
because it generally acts right at the site. Once it's stripped down to this,
mm,
it's going to act right there at the site, whether it be joint pain or muscle pain or something like that. You wouldn't rub it on your elbow because your toe hurts,
mm.
which means right,
Yeah,
systemically, it's not going to take those things and plant them in your toe.
right.
I mean, that's
You
kind of the obvious thing with the topical. Now, let me give you an example. One of our people, actually one of our surgeons, said his mother was confined to bed now
mhm.
because her shoulders were so bad she couldn't use her walker. Okay, she started
Yikes.
using our pain cream on her shoulders. Now she's able to get up out of bed and use the walker and motivate around the house and do what she needs to do. He
Mm,
said, life changing.
amazing.
That truly is life changing. Now, the other surgeon, he said, you realize when you're a surgeon that people don't know that you are standing for a number of hours bent over looking into somebody, right, which is not the most comfortable position. And then
Mhm.
your arms are out and you're working and all this kind of stuff. And after a period of time, you get fatigue. And then after a period of years, it starts to become painful, right?
Right.
He says now before surgery, rubs that cream on.
Mhm.
No problem. Okay.
Yeah, and that's the beauty of a topical cream is
Yeah.
that you can have it localized to a particular body part or area of discomfort and
Yes.
not get the psychoactive effects that you would if you ingested or inhaled it.
100% correct. 100%.
Uh, that's amazing to hear that they're starting to understand the benefits themselves, your partners being, uh, because now they have the ability to explain this to their patients post-op if they have to, of like, here's a product that could change your life, and it's not
Mm-hmm.
just for right now. This could be a long-term use.
Right. Right. If you have a chronic condition, I mean, let's say when I was in the compounding arena, had my pharmacy at my center, we would make strong prescription pain creams for things like phantom limb pain, right?
Mm,
Which is very
okay.
real.
Yes.
Um, Now, that is a chronic condition. You're not going
Hmm.
to cure that, but you're also not going to want to take opioids
No.
forever, right?
No.
So if God God hope that our cream can help relieve some of that,
Mhm.
excellent, excellent. So it is more of a long term type of thing where there are benefits that we have that nothing else out there really does.
So, by you saying that, now let's dive into the topic we were talking about before we hopped on. So, with a product that you want to push forward in the United States, what's the process of going through the FDA and clinical trials?
Okay, great question. Um, right now, the CBD, and we generally refer to them as CBD products, knowing that we use, broad spectrum. We have all the cannabinoids. Okay.
Hmm.
Um, the labeling requirements generally need to meet the FTC standards, not 100% the FDA standards.
Okay.
However, our product labeling, it does. We put the active ingredients in there, we put the dosage, we put everything that is there. We're allowed to say it's proprietary.
Hmm.
Now, one of the reasons that we do the proprietary thing is to stop people from copycat, right?
Yeah.
So no one knows what cannabinoids or what terpenes are in there, but I will tell you the other ingredients. I will tell you the MSM is in there and the curcumin and that kind of stuff. So you have opened up where I really am interested in going with the trials.
Hmm.
Now, there's two things. I want to do clinical trials with our products and using the patients that our surgeons have. Now,
Okay.
these trials will be observational studies.
Okay.
Okay. Whereas, because we're not going to give somebody at this point something that is a placebo and something that's real and say, try these, and then this group switch over and then try to prove that our stuff worked in both groups better. That's a double blind crossover type of study. We're not going to do that. We're looking for effectiveness. Like I said, they call RWE, real world evidence.
Okay.
That's what I want. Okay. I want that. When we get a study, now, Dorian, this is amazing. When we get a study and we're able to show results, and we're not going to bias this at all, because so many studies today are biased. You just look at who pays for it and you go, oh, well, they're biased. Well, I'm telling you it's biased because we got the best product. So let's see how it stacks up. All
Hmm.
right.
Hmm.
So we're going to get these results. When we get these results, the the mainstream medical groups like Society of Surgeons, the American Academy of Orthopedic Surgeons, people like that use that as one of the criteria to have you present to give your information to others.
Okay.
Okay. If you don't have a study, they kind of go, well, you're just talking through your hat, right?
Right.
You don't know, give me some more evidence than you think or your next door neighbor said. Okay.
Hmm.
So that will allow us to use, as you say, why the studies, to use our study results as an entree into a more of a mainstream type of publicity, whatever you want to call it, to get the word out.
Right.
Now, the thing that I have talked about for a long time is I want to know if there are certain cultivars, because I think there are,
Hmm.
with different amounts of cannabinoids in there. Everybody says CBN for sleep. Okay. So I want to know, I want to get a that maybe has a higher CBN concentration than what we're used to using, and use that for our sleep product that we call Dream On, because you can't say sleep. Okay. So I'd like to see that. Then I'd like to see maybe a cultivar that is really high in the terpene of myrcene or
Hmm.
something like. Maybe that's going to be the one I want to use for pain because it's better than the others. You know,
Right.
that's where my research and my study is kind of leading me to.
Okay.
Okay, let's find the best products, the best extraction method, right? The best C of A's that I can get, and let's use those for a more specific targeted treatment.
Hmm. And then moving forward from there, as you're mentioning that the products are making are considered, is this the term that you're coining, cannaceuticals?
Yeah, yeah. Now my one
So,
partner doesn't like it, but I like it.
so is this like gonna be more on the supplementation side, or are you trying to get it into pharmacies one day?
Okay, good question. It's going to have to stay supplement side because of the laws in pharmacy.
Mm.
Okay. Now, take for instance California. Um, rec is legal, CBD is legal, everything is legal. California State Board of Pharmacy does not want you to have that in there, and they will fine you, they will shut you down, they will kill you. Okay, if you have it.
Yes.
The only people they will allow, why is
Mhm.
that? Well, because it has got a tremendous influence on the Board of Pharmacy. Those people are, um, let's say, partners with big pharma and big insurance. It's their little triad. This is how things should work. Doctors should see these poor guys should be overworked and killed with seeing dozens and dozens of patients, and they should prescribe dozens and dozens of things. And the pharmacy should dispense those things and buy them all from big pharma, and we're all happy. No
Mm.
one considers the patient. Okay? And that's one of the inequities here. So to bring it all back, we have to stay in that gray area. We're at the way things are now, we're not going to be allowed to get anything like this into pharmacies unless something changes. And
Mhm.
I don't know what that change exactly is going to entail or when it's going to happen, but it does need to happen. It really does. It's just like, take for instance, any pharmacies out there now. If you walk into a pharmacy and you ask the pharmacist, what do you think of CBD? Why don't you guys carry it? Whoa, boy. They're going to go, first of all, there was actually a mandate from the California State Board of Pharmacy some years ago that said, you can't talk about this.
Mm.
You can't talk about CBD to your patients. And there was a group that got together that countersued the state board and said, have you ever heard of freedom of speech? We know you think you're all powerful, but you can't supersede freedom of speech. If I want to talk about it, I'm going to talk about
Mhm.
it. Okay. And they backpedaled. That's how important they think they are.
Mhm.
Okay. I could go off on this all day. It's for a different podcast on the rules and things, but that's just to give you a flavor of why we're not um, attacking pharmacy as much as we can now. People have done that. There was one guy, I forget who it is, that originally got into, and their products were, there was something wrong. They were harming people, whatever it was. Oh, they were all mislabeled.
Mm.
And the state boards came in, notified the FDA, and the FDA made them get rid of all of it, pull it all out, because it did say pain and sleep and all of that kind of stuff, because nobody in the hierarchy decided to check the law. It's, hey, we can make money.
Yeah. Yep.
I'm sorry to digress there, but you
No.
you open it
No.
up by saying, "What about getting it in there?" And
Hey.
practitioners can be afraid,
Yeah.
physicians can be afraid to say, "Well, I'm not going to carry that in my office." Some do, but that's why we have the referral program, right? For them, you can just refer them to our site, and you get paid.
Yeah, for sure. And I'm glad that we're opening up this discussion because I think it's one that still needs to be addressed. I think
Oh yeah,
that you are not alone in this. I know there are other pharmacists and other physicians who are also going in the similar direction of cannabis advocacy and using evidence to back up what
yeah,
you're talking about. You do have the right to express how you feel about this compound and
yes,
all of the research that that comes with it.
oh
So
yeah,
it's wild because I haven't heard that side of the industry. So
oh
you're opening up a whole new thing to
yeah.
me, perspective wise, and it's good to hear that you are a proponent that has extensive experience from that side of the world, and now you're trying to translate it and push it for patient safety on the other side.
No, exactly. I appreciate that because that, you hit it. I mean, that's the goal is to come at it from all angles, to do whatever I can to help people, right? To kind of, I'm not really into yet tearing down the barriers, but I'm kind of going around some of them
Mhm.
because people deserve it.
Absolutely, absolutely, and that's one of my main driving forces that people do have the right to use whatever they feel in this country that can benefit them in some sort of way. So having educators, having scientists, having researchers, clinicians that can help people understand what they're putting into their bodies is very important. And this is a free resource for people to understand
Yes.
these topics that are difficult to
Yes.
understand.
Yeah. No, I gotta throw a shout out to you. People that do podcasts like this are my new heroes, because now you have to
Appreciate it.
remember, for decades, the
Mm,
only way we got our information was through studies published in journals.
right.
And they became more and more biased as they were bought out by, the evil empire. um, and we were not hearing of the science on things until people like you said, "Hey, wait a minute, there's some information here people need to hear." And now I'm so glad, because it's open, it's a free forum type of thing that goes along with our what Second Amendment or what First Amendment, whatever it is, free speech, right?
Yeah, right. And that's essentially what I'm building is a platform for people that are intelligent, driven, ambitious, that want to see the best products put forth and the best resources for people to have in this taboo sphere because it is taboo still. I
Oh
mean,
yeah.
yeah, it's getting more accepted to use different products that are outside of modern medicine. But now that there's more evidence to suggest that it is safe to use or safer than most
Mm-hmm.
substances that they take on a regular basis, that's amazing.
Oh yeah, yeah. I mean, I don't know what to say. It's not even close to the efficacy and the positive aspect of this compared to the negative aspect of other things that are there. Again, we're not talking about acute type of things, right?
Right,
I
right.
mean, if you need acute medicine, you get it. But there are a lot of other things, and we're gonna, I mean, we could get into specifically the brain and the mental aspect of these things, and how the brain works, and where these things work in the brain, and how other things are detrimental. And in our society now, it seems to be all about who can come up with the next drug. And I just now, I laugh at some of the commercials, and then I'm also pissed off at some of the commercials because of what they're doing to people, under the guise of helping them, but realistically just trying to make money, sell products. I don't know how they sleep, but they must.
Yeah, and I think with that, with like commercials that specifically target pharmaceutical drugs to the general public, it has grown substantially because I don't really watch TV at all. And just knowing that when I do turn the TV on, I'm expecting to see at least three advertisements for three different drugs
Oh
and
yeah,
all of the stupid side effects that come along with it. Now,
yeah,
I'm not saying that these aren't beneficial to patients, but I think that discussion of what that can do for you on an individual basis needs to be had between physician and patient. It
yeah,
does not need to be televised like it is. It's fucking ridiculous. And the
yes.
same goes for alcohol.
Oh yeah,
I'm very like so I stopped drinking alcohol in 2015, and it's funny that you can have a sports organization sponsored by alcohol beverages, but if you smoked any weed as an athlete, you would be criminalized for it or kicked off the team. But now it's changing. But for so many fucking years, you have alcohol driving profits forward for all these
yes.
major sports teams. And it's like, wait, what the fuck? Like that
I
is the
know it.
worst. That's the worst thing that you can have for your body on a given
Oh,
basis.
it's terrible on so many levels, and if we talk about a moralistic type of thing, um, ask yourself what you would rather your kids experiment with, pot or alcohol.
Mm.
Do you want your teenager out there drunk driving? I don't
Yeah.
think so. And we've made that legal. And this is a funny thing. From my perspective, we all know, we all learned in school, alcohol is a drug, alcohol is poison. Okay, alcohol is not controlled by the FDA. It
Nope.
is the only quote unquote drug that I know of that's legal that you can go buy and you can kill yourself or others with it because you dosed yourself inappropriately. It's up to you to know how to dose yourself.
Yep.
We don't do that with heart medications, right? We don't do that with
Mm.
anything else. But
Mm.
this one that you can actually kill people with, go ahead. To
Yeah.
me, that's insane.
It is. It's very insane, and this is part of my approach for seeking out people that look at alternative options as being the future. Like these substances are going to be studied, and it doesn't matter if there are regulations against it or restrictions, because it's going to continue to push forward since more
Yes.
people are breaking away from that society and emerging back into this renaissance of the psychedelics and the
Yeah.
psychoactives.
Yes. 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 And that's a good point because we'll say podcasts, the internet, whatever it is, the modern way that we're all communicating is getting information out that people can sift through to find out what's garbage for the most part and what's good. And if you really want to dig into any topic, you can dig into it and you can find out some good information to make choices for yourself that we don't have to have, as they say, you don't necessarily have to have your health care outsourced to big pharma.
Mm.
Why would you outsource your care to these people?
Mm.
Right? You're responsible for your own health care.
Yep.
And the same thing with the drugs, right? You're
Yep.
you're you're saying that what these people have that they admittedly are going to make money on, and that's their goal, and they're saying, yeah, sure, go ahead, take it. And then at the bottom of the commercial, all the different side effects, things like that. Your arms are falling off, or whatever it is. And you go, yeah, but I need that because that lady's dancing around looking happy.
It's the fucking truth.
Isn't it though?
Oh man. Yeah, but heaven forbid that you put up a billboard that has someone with cannabis. Like, yeah, that's a
Oh,
no no.
blasphemy. Yeah. I like the old saying where they say you get uh, five guys together in a bar
Mhm.
and they're going to start a fight, right? You get
Right.
five guys smoking pot together and they're going to start a band.
On Rock Hero, set up and practice.
Yeah, exactly.
uh, so the cool thing that Las Vegas is doing, and I know California has probably already done this in Southern California with consumption lounges, but what do you think about the cannabis consumption lounge that's about to open up this year?
I have a lot of thoughts on that.
Yeah.
First of all, um, it's about time.
Hmm.
Okay. Um, Second of all, I don't know the ownership, but I hope, and this might seem controversial, but
Mm.
I hope it has something to do with our indigenous, our Native American tribes that are around that are pushing this kind of thing. I
Hmm.
hope so because if there's money to be made and it can be put to a good use, great. That's one aspect. The other aspect is hopefully they have their safety measures
Hmm.
involved. I don't anticipate too many parking lot fights, but I do think that if there's safety somehow is involved where they people understand when they've had too much or shouldn't be driving or doing whatever. I hope that people will take that into consideration. And I think there's an ordinance. You may know this. You may know this.
Hmm.
um, that you are not allowed to consume cannabis in Nevada, maybe it's Vegas,
Hmm.
unless you own the building. Have you heard of
Hmm.
this?
Mm-mm,
Which
I haven't.
means, and I think they did that to keep it out of hotels.
Um,
I think.
yeah.
I mean, that you can verify that may be a rumor, but that also means that if you're a renter in town, you can't either.
Hmm.
Right.
Interesting.
So I don't know, but the lounge type of thing then is something that is gonna it's gonna be a must for people who want to. If you're not allowed to smoke in hotels or whatever, I'm sure people do, but the lounge is going to be something that's going to provide an outlet. Let's say.
Yeah, no, I'm super excited to see what happens. I know Las Vegas is big on hospitality and
Yeah.
bringing, 4-star ratings. So it's going to be interesting to see the level of detail that they put in for people that are coming in to just specifically try different strains. And then also just like what the culture is going to be built around. That's the
Yeah.
other interesting thing that I'm looking forward to.
Sure. Yeah, it's going to be quite the adventure, and I'm sure it's just the first one, right?
Yep, it's the first one. So this is the
There'll be
experiment.
more.
What excites you most about the future of cannabis-based therapies?
I would have to say there's a few things, but the thing that excites me the most, and being kind of a researcher, um, as well as a healthcare guy, it's the possibility of having products that are going to be extremely targeted for people's well-being.
Mm,
That's the most, to me, that's it. To where if somebody has an issue, hey, we have something for you.
mhm,
That kind of thing. Um, I would say, yeah, that's probably the main thing. And then the ability, which is exciting to me, to, as I always say, get the word out,
mhm,
which is people like you are helping us do that. Hopefully, people will see this and they'll say, hey, I like some of the stuff he says. Maybe I should get my Aunt Tilly to try this because she's got chronic fatigue or
right.
something like that, right? That
Mhm,
that's my goal. I've got so many little testimonials and stories that just make you smile. They go, yeah, this is exciting to be able to help people. That's the main thing.
love that. I think that's a good place to end off. And as far as like closing questions go, I
Uh-huh.
like doing this with guests. What is your favorite genre of music to listen to decompress?
Well, wow, my music tastes go everywhere, but to
Yeah.
to decompress, I'd say like one of those flute kind of things that you hear when you get in a massage.
Uh,
That's
yeah.
decompress, but otherwise, and this is funny, there are studies out that say for your optimal mental well-being,
Hmm.
you should listen to about a half an hour to an hour's worth of music that you used to listen to that brought you the most joy,
Mm-hmm.
right? So now for
Mm-hmm.
me, it would have to be some old rock or
Mm-hmm.
something like that.
Yeah.
Whatever it is for you that makes you feel good, that your optimal time in your life when you felt really good, which is not to say when you had a bad breakup and you listen to melancholy stuff, like, no, I don't want to do that.
No.
Right. So for me, it's kind of like the old rock, but I listen to everything, reggae, some hip hop. It's just anything that happens to hit that strikes my fancy.
Cool. Uh, Favorite product to consume, is that your edibles or is like the topical?
For me, it's the topical, without a doubt. I got to tell you, and I point this out to people, and I'm shocked at how well it works. I'm
Mm,
I'm really shocked at all of our products. I tell everyone, don't expect anything right away. Don't expect the sleep thing. Give it a few days, and everyone says, "Oh no, works right away."
Mm,
Same thing with the topical cream. It's like I can't believe that I can rub this on my knee if it's acting up, and it just stops hurting.
mm,
It's just, to me, it's amazing. I hadn't had that since I had, playing football in high school. I had a cortisone shot in the knee. You know, okay, now it doesn't hurt. It's the same type of thing. It's like, wow, I'm continually amazed by this.
I love
So
that you
that would
use
be it.
your
It would be the topical cream.
yeah, I love that you use your own products
Oh
because
yeah,
that's what you should be doing if you are creating a brand. It's like you're creating a product that you would use yourself.
yes, yeah, exactly. And believe me, I've tested every single one of them. We have one that's it's called Tranquility for
Hmm.
anxiety. Unbelievable. Some of the testimonials, just I could go on and on, but they everything that we've made has been pretty much a winner.
Amazing. I'm gonna have to try it out.
Yeah.
Uh, what is your favorite hobby?
My favorite hobby, let's say, it has to do with, and this is a strange hobby, with wellness.
Mm,
Okay, which is crazy. Okay, so my hobby is, yeah, of course, walking my dog in the daytime, but weightlifting, but doing things for wellness
hmm.
that research is telling us um, have to do with wellness and longevity. So it's like my hobby is to get on to podcasts, find something like cold therapy,
Hmm.
something like that, right? Time restricted eating, you know,
Hmm.
things like that, to take those on and to try those and see how I benefit. That I think it's not like, like my surfing days are over, that kind of thing. So
Hmm.
this is the new thing, to explore new avenues of wellness.
Amazing. I like that. Uh, Last question. What advice would you give to someone who wants to get into a STEM related career?
Um, okay, first bit of advice is follow your passion.
Mm,
Okay, if you have, and I guess it's an aptitude toward a science type of thing, mathematics, whatever it is, like technology, whatever you're talking about.
mm,
If you have a passion toward that, follow that. If you have an aptitude toward that, even better. But don't be afraid to change. Right. If you decide that you don't want to, now I will give you an example. I have three daughters. My eldest daughter started out as a chemistry major in
hmm.
college, mainly probably because I was,
You're right.
right, following that science kind of path.
Hmm.
Realized, ah, no, that's not it. Today she's a lawyer. Okay,
Amazing.
so started out that way, wanted to go into physical therapy, something like that, and then went, no, don't want to do it.
Yeah.
So don't be afraid to change, you know, once it's said, and even careers. I mean, take for instance yourself, right? You've changed. Don't be afraid to change, because that is something, that goes along with what we call neuroplasticity
Hmm.
in your brain, to keep those nerve circuits growing and functioning well, so you don't become too complacent. It keeps you thinking, your cognition going, helps stave off Alzheimer's, all of this kind of stuff. So make sure that whatever you're doing is not boring. Follow your passion.
Stimulating. Right.
Oh, yeah.
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 So thank you so much for being
Oh,
on
you're
this
welcome.
podcast episode. And I want to ask you, for the audience, where can people find information about you and your products and your company?
Oh, okay, great. The website is the best thing. It's called Prism Earth, and it's two M's. One of the guys that helped form this said it stands for the Preeminent Research Institution of Specialized Medicine and Manufacture. Okay,
Okay.
prismearth.com. And you'll see brief bios on myself, my two surgeon partners in there, and all the information that you're going to want, and even more on our products. So prismearth.com.
And do you have any social media accounts?
Oh God, yeah, I do. I can like on LinkedIn and all this kind of
I'll
stuff.
I'll add those to the notes as well. All
Yeah,
right,
yeah. The
cool, man.
company's forcing me.
All right, Dr. Quinn, thank you so much, and we look forward to you on a future episode.
Okay, appreciate it. Anytime, Dorian. Anytime. Take care.
Take care.